Hello. Today I want to talk about three difficult conversations that I sometimes have to have as a physical therapist with my patients. I work in the home health setting now, but I have been in skilled nursing before and outpatient and hospital settings as well, but mostly in home health. So, one of the conversations that's difficult to have is that maybe a patient is no longer safe to be ambulatory. So, maybe we've come to that point where we've tried different interventions, we've tried different assistive devices, we've tried different levels of support, and for whatever reason, whether that's a medical condition that's truly limiting their sensation or strength gains, or maybe it's a cognitive issue that's really causing some impulsivity or difficulties with safety awareness that are just too much to overcome with interventions and supervision level. So having to have that conversation with people, which as a physical therapist, my goal is always to help people get better, get back to what they want to do, quality of life, everything like that. So having that conversation I do not take lightly, and it's definitely a tough one to have. And it's usually something that we approach over a period of time because we want to make sure we've tried everything if that continues to be a goal for the patient or their family and caregivers. Another difficult conversation that sometimes comes up is that physical therapy is no longer appropriate for a patient, or we've really reached that max potential point. So similar to the non-ambulatory conversation, but more of like a overall, just maybe physical therapy is not right for you right now, and maybe we need to take a pause and kind of go back to some of your other medical providers and see if other interventions are more effective for you. So again, not something that, spontaneously occurs potentially, that this is something we've been thinking about over time, or just trying interventions and not making a difference. And so it's time to reevaluate and see what other providers might be beneficial as well. And I do love that about home health, where I have the opportunity to bring in my colleagues, such as speech therapy or occupational therapy or nursing or even social work, to kind of guide us or help with other perspectives, and we can continue to collaborate as a team and see if we can meet goals as a team. But sometimes there are just things that need to be further assessed with imaging tests or medication changes, and waiting, for specialist appointments and things. So trying to find a stable point where we can put therapy on hold and make sure they have the support they need for a discharge, and then maybe readmit later in the future. And then the third conversation that comes up that's definitely difficult at times is that someone needs to consider a higher level of care. So in general, from my experience, of course, people want to stay in their own homes as long as possible, or if they've been in like an independent living facility for a while, that's home to them, that's where they want to be and want to continue to live there as long as possible. So, and it's definitely not that assisted living is always a bad experience, and I do think it gets kind of a reputation for that because it sounds institutionalized, restrictive, lack of privacy in some ways, with caregivers kind of coming in and out as needed. So it definitely, a lot of times it's not the goal for the patient to move to a higher level of care, assisted living or nursing level or things like that. So sometimes when we really have to talk about what things we're seeing on our evaluation, how our course of care has gone, whether that's led to improvements or not, or if we just feel like that's insufficient supervision and they really would benefit from more caregiver involvement, more supervised care. So that can be some of the reasons behind it. And yet again, it's not like I typically come in on day one and go, you shouldn't live here anymore, you need this, you need that. We really want to assess where the person is at, see if we can kind of make a care plan with caregivers or family involved, and move forward and see what improvements can be made before we make really big life-changing decisions right off the bat. So Yeah, so those are three conversations that over time I've definitely had to learn how to navigate, how to use my assessment, how to communicate that clearly as far as the perspective we have of what we're seeing as a care team, what our concerns are, and then, of course, talking to the patient about what their decision is and whether they have the cognitive capacity to make that decision and who else is involved, and then we can move forward from there. But those are definitely some tricky situations to navigate. Of course, as a physical therapist, I always want to come in, assess, make things better, and sometimes that's just not the case, and we need to look at it with a whole team approach and make a different plan. So feel free to leave questions below or subscribe so you can see videos. I'm hoping to be a little more consistent in the future. Thanks. Bye.